So NICOS provides currently the toll-free hotline, which is recently gone statewide and 24 hours, 7 days a week. And that's actually the best way to get access to all of our services. Once accessed, the hotline can actually refer the client to, for example, just mailing them more information like literature, generally all bilingual, or actually signing them up for face-to-face counseling if they live within the San Francisco area. And then most recently, if they don't and they are interested to receive telephone counseling, they can also actually sign up to receive problem gambling telephone intervention or PGTI services. So NICOS actually, and as Kent mentioned, does a lot of education, advocacy, and training. And so we also have actually some research studies that we run in partnership with academic institutions like UCSF and San Francisco State University to examine, for example, the use of lay health workers or promotoras to promote the cancer prevention and screening. We have other programs that actually work on other kinds of research looking into health disparity in the Asian American community, and also other health education and media campaign projects to raise awareness about various different health issues and to promote prevention. So one of the things we've seen over and over again is just how severe sort of the situation is when problem gamblers present to us for services at the time of hotline call or even at the time of actually seeking direct services. And a lot of times we're seeing an increased amount of debt, generally sometimes amounting to whole year salary or more, and a lot of times having a lot of other impacts to their lives like relationship issues. A lot of our clients are only coming because their loved one is threatening to leave them and so forth, and there's a lot of chaotic dynamics, and which means that they're often harder to treat and that they bring along a host of other issues that are co-occurring and may interact with their gambling recovery. I think what we found in a lot of qualitative focus groups and a lot of key informant interviews is that mental health in general is a concept that's not really well understood, and it's not really, folks don't equate it on the same level as physical health. And so a lot of folks equate, for example, mental health, equating it with insanity, and that there's really not a concept of seeking help for mental health or related disorders. And gambling in particularly also, as Ken had mentioned, is so common and so culturally accepted. It also means that it's more difficult for members of that community to realize when there's a problem. And then seeking help and bringing that information, that family, private information outside often is sort of discouraged. And then generally when we see them is when finances are so unmanageable that they feel like they have no other choice. So we do see that certain cultural values, but as well as life experience, often influence a lot of the clients we see. So talk about life experience a little bit. A lot of our clients, looking at their socio-political and personal histories, they come from places that maybe they've been subjected to abuse, subjected to torture, political torture or trauma. A lot of our clients are immigrants or even refugees and asylum seekers, and that obviously brings with it a host of very unique psychosocial issues. And then cultural values, you mentioned some, but just this reticence of seeking outside help, airing dirty laundry, and just this lack of concept that behavioral issues can have physical roots and that there are help for them. I think those are still pretty new concepts, and NICOS has been trying hard to do a lot of outreach through media and through public campaigns to change a lot of that perception so that folks know that this is okay. There are other folks who go through that and that there's help out there. What we do find is that even though for many of our counseling folks who actually speak English and they're fairly fluent, they've been, for example, in the US for over 10 years or even 20 years, many of them still report that there are certain things that they can express more eloquently or more directly in their own language, and that they still do have a preference for a counselor who is of the same cultural background. And that is pretty clear in a lot of the conversations we've had with clients. And so just paying attention to sort of the linguistic and cultural competence, I think even just for a counselor of not the same cultural background but makes an effort and sort of gets to know and tries to understand and be sensitive to some of those cultural issues, I think can be be very helpful in gaining the client's trust and building the rapport. So I would say really paying attention to that and consulting folks, experts who are familiar with the culture, with the community, I think would be helpful as well. We've also actually been doing a lot of curriculum development. A lot of it actually focuses on vulnerable populations like APIs, but in addition to that, focusing on gender like women, focusing on age like older adults and youth. And so this is a project where we've been taking this curriculum to many different constituents throughout the state and trying to provide basically a very culturally competent training and to prepare service providers in the human service field on how to properly screen, assess, and also refer for appropriate resources.